Hello, my friends. I'm Dr. Jocelyn, a urologist and men's health specialist with 5 years of clinical experience, and today I'm going to give you advice that most men never hear in their lifetime. This is the kind of conversation that might make you blush a little, but I promise you, it will change the way you think about intimacy, confidence, and even your health as a man. Before we dive in, do me a quick favor, hit that like button, subscribe to the channel, and tell me in the comments where you're watching from. I love knowing how far this community reaches, whether it's a busy city apartment, a quiet retirement town, or somewhere in between. Now let's get into it. Here's the truth that nobody tells older men. Intimacy does not retire. Passion doesn't have an expiration date. Yet I see too many men giving up, thinking they're too old for deeper connection, or worse, that their body is betraying them. But here's the myth we need to bust today. Problems in the bedroom are not always just age. Often they're linked to small, manageable habits, things you can change starting right now. And today, we're going to explore one of those exact topics men ask me about all the time. Intimacy practices that feel taboo to discuss, but actually open the door to more trust, more pleasure, and better performance. I've spent the last 5 years as a urologist helping men just like you, men in their 50s, 60s, 70s, and beyond, reclaim confidence in their health and their intimate life. I can tell you this, the science is clear. When men understand how the body really works, the biology, the emotions, and the day-to-day reality, they make better choices. They reconnect with their partners and they rediscover a kind of freedom many thought they had lost forever. So today, I want to break it all down into clear, practical advice you can use. Let's walk through 5 key truths and mistakes men often make about intimacy, fluids, and connection, each one building on the last. Stay with me, because number 1 will surprise you the most. Habit mistake number 5, thinking vaginal fluids are dirty. Let's start here, because this is the root of so much embarrassment. Vaginal fluids are not random moisture. They're a masterpiece of the human body. Biologically, they're produced by 3 main sources. The Bartholin's glands, which secrete silky fluid to reduce friction. The Skene's glands, sometimes called the female prostate, adding more lubrication during arousal. The cervix, which provides mucus that protects and balances the vaginal environment. These fluids are mostly water, plus amino acids, enzymes, minerals, and lactic acid, designed to protect delicate tissue, reduce infection risk, and make intimacy safe and pleasurable. Emotionally, when a man rejects or judges these fluids, it can create shame in a woman. Practically, it damages trust and makes intimacy feel unsafe. So here's the shift. Don't think of fluids as gross. Think of them as the body's natural signal that connection is possible and safe. Habit mistake number 4, ignoring taste and smell. This is the number 1 private question men ask me. What about the taste or smell? Here's the biological truth. Fluids vary. Diet, hydration, hormones, stress, and even medications all change the profile. Pineapple, citrus, and hydration, often fresher, lighter taste. Garlic, onions, alcohol, or coffee. Stronger edge. Hormones, around ovulation, fluids are neutral. Around menstruation, a faint metallic note. After menopause, fluids may be less abundant or slightly more acidic. Emotionally, here's what matters. Variation is normal. No 2 men smell the same after a workout. No 2 women taste the same either. Practically, if there's a sudden unpleasant change with discomfort, it's usually a common treatable imbalance like bacterial vaginosis or yeast infection. That's a doctor's visit, not a deal breaker. The mistake is turning normal variation into criticism. Gentlemen, acceptance is more arousing than judgment. Habit mistake number 3, overlooking safety. Now, the big question, is it safe to swallow fluids? The short answer, for healthy couples, yes. Fluids are mostly water, enzymes, and protective compounds. In fact, they're biologically less risky than things we do without thinking, like kissing or sharing drinks. But here's the caution. Fluids can carry sexually transmitted infections, just like semen or blood. Chlamydia, gonorrhea, herpes, syphilis, trichomonas, HIV. The risk is higher if one partner has an active infection, and even more if the receiving partner has mouth sores, bleeding gums, or ulcers. Biologically, risk exists. Emotionally, honesty